Hey guys, welcome back to the channel. Today we're talking about a topic that honestly should be on every single dog owner's radar right now, because the risk is genuinely bigger than most people realize, and it keeps growing every single year. We're talking about tick-borne diseases in dogs. If you think ticks are just a summer problem or something that only affects dogs who live out in the countryside or go hiking a lot, I really need you to stick around for this one, because that thinking is honestly outdated and it could put your dog at real risk. So let's dig into everything you need to know: what these diseases actually are, why the risk is expanding so much right now, what the symptoms look like, how we diagnose and treat these conditions, and most importantly, how you can protect your dog. Let's start with the big picture. Ticks are small parasites that attach to your dog's skin and feed on their blood, and while the bite itself is usually not a big deal on its own, the real danger is what many ticks are carrying. Ticks can transmit a whole range of different bacteria, parasites, and in some cases even viruses, directly into your dog's bloodstream while they're feeding. And here's the thing that a lot of owners don't realize: a tick doesn't even need to be attached for very long to transmit some of these pathogens. Depending on the specific disease we're talking about, transmission can happen in as little as a few hours, though for some diseases it takes longer, which is exactly why quick tick removal really does matter, and why prevention is so much better than trying to catch it after the fact. Now, I really want to spend some time on why this topic has become such a big deal recently, because this isn't just fear-mongering. The data genuinely backs this up. Veterinary parasitology organizations that track disease patterns across the country have been putting out forecasts showing that tick-borne disease risk is expanding geographically year after year. Areas that used to be considered low risk or moderate risk are now seeing significant increases in cases. We're talking about diseases like Lyme disease, ehrlichiosis, and anaplasmosis spreading well beyond their traditional hotspots. Regions that historically didn't have much tick-borne disease concern at all are now seeing meaningful numbers of positive cases in dogs. And this expansion isn't stopping at old boundaries. Ticks are essentially moving into new territories and bringing these diseases with them. Why is this happening? There are a few contributing factors that experts point to. Climate patterns are shifting in ways that allow ticks to survive and remain active for longer periods throughout the year. And in areas where it used to get cold enough to significantly reduce tick activity during winter, ticks are now managing to stay active for extended seasons, sometimes almost year-round in certain regions. Changes in wildlife populations and movement patterns, land development pushing into previously wild areas, and increased travel with pets between different regions of the country are all thought to be contributing to this spread as well. The bottom line is, tick-borne disease is no longer something you can dismiss just because you live somewhere that historically wasn't a hot spot, or because it's not currently the warmest part of the year. The experts in this field have been pretty clear about this. Low risk does not mean no risk, and year-round prevention has really become essential rather than optional, no matter where you live. So let's get into the specific diseases themselves, because there isn't just one single tick-borne disease to worry about. There's actually a whole group of them, each caused by different ticks carrying different pathogens, and each with its own particular set of symptoms and concerns. Let's start with Lyme disease, probably the most well-known of the bunch. Lyme disease is caused by a bacteria called Borrelia burgdorferi, and it's transmitted primarily by black-legged ticks, sometimes called deer ticks. This disease has historically been concentrated in the northeastern United States and the upper Midwest, but as I mentioned, it's now expanding into new regions, including areas of the broader Midwest and Southeast that weren't traditionally considered high risk. In dogs, Lyme disease can be a bit tricky because a lot of infected dogs actually never show any obvious symptoms at all. Their immune system manages to keep the bacteria somewhat in check without becoming clinically ill. But in dogs who do develop symptoms, what we typically see includes lameness that can shift from one leg to another, sometimes called shifting leg lameness, along with fever, lethargy, reduced appetite, and swollen joints. In more serious, though less common cases, Lyme disease can actually affect the kidneys, leading to a condition called Lyme nephritis, which can be quite serious and, in severe cases, life-threatening. This is really the aspect of Lyme disease that concerns vets the most, because kidney involvement can progress seriously before it becomes obvious to an owner. Next, let's talk about ehrlichiosis, which is caused by several different species of bacteria in the Ehrlichia family, and is transmitted mainly by the brown dog tick and the Lone Star tick. This disease has three general phases if left untreated: an acute phase shortly after infection, where dogs might show fever, lethargy, swollen lymph nodes, and sometimes nosebleeds due to effects on blood clotting; a subclinical phase, where the dog appears to recover and shows no outward symptoms even though the bacteria is still present in their system, sometimes for months or even years. And then some dogs, a chronic phase can eventually develop, which can be much more serious, involving significant effects on the bone marrow, bleeding disorders, weight loss, and other systemic problems. This subclinical phase is honestly one of the trickiest parts about ehrlichiosis, because a dog can look completely fine for a long stretch of time while still harboring the infection, only for more serious problems to surface later on. Then there's anaplasmosis, caused by bacteria in the Anaplasma family, and also transmitted by several tick species including the black-legged tick and the brown dog tick. Symptoms of anaplasmosis can look quite similar to ehrlichiosis, and even Lyme disease in some ways. Fever, lethargy, joint pain and lameness, reduced appetite, and sometimes vomiting or diarrhea. Because these tick-borne diseases can look so similar to each other on the surface, and sometimes a dog can even be infected with more than one at the same time from a single tick bite, proper testing really becomes important for figuring out exactly what we're dealing with. Rocky Mountain spotted fever is another one worth knowing about, caused by a bacteria called Rickettsia rickettsii, transmitted by several tick species depending on the region. This disease tends to come on quite acutely and can be genuinely severe, even life-threatening if not caught and treated promptly. Symptoms include high fever, lethargy, joint pain, and in more advanced cases, bleeding abnormalities and neurological signs. This is one of those tick-borne diseases where time really matters. The sooner it's identified and treated, the better the outcome tends to be. I also want to mention that researchers continue to identify new tick-borne pathogens that we're still learning about. In recent research, scientists have identified additional spotted fever group bacteria species affecting dogs in various regions, which is a good reminder that our understanding of exactly what ticks can transmit is still evolving, and this really underscores why broad-spectrum prevention approaches matter so much, rather than just focusing narrowly on the one or two diseases we've historically talked about the most. And then there's tick paralysis, which works quite differently from the bacterial diseases we've been discussing. This is caused by a neurotoxin present in the saliva of certain tick species, and rather than an infection building up over days, tick paralysis can develop relatively quickly, causing progressive weakness that typically starts in the hind legs and can move forward toward the front legs and eventually affect breathing muscles if the tick isn't found and removed. The interesting thing about tick paralysis is that it's directly caused by the toxin itself, not an infection, so once the tick is removed, dogs generally start to recover, sometimes within hours to a couple of days, though severe cases affecting the respiratory muscles can be a genuine emergency requiring supportive care. Now let's talk about how you'd actually recognize that your dog might have a tick-borne disease, because the symptoms across these different conditions do share a lot of overlap, which is honestly part of what makes this category of illness tricky to identify just from how your dog is acting. The most common signs across the board tend to include lethargy or general low energy, reduced appetite, fever, and some form of joint pain or lameness, which might be constant or might seem to shift between different limbs over time. Some dogs will show swollen lymph nodes, which you might notice as small lumps under the jaw, in front of the shoulders, or behind the knees. Depending on the specific disease, you might also see things like pale gums, unusual bruising or small red spots on the skin, or gums indicating bleeding abnormalities, nosebleeds, vomiting, or in more severe cases, neurological signs like disorientation, tremors, or difficulty walking properly. One thing I always tell owners is, if your dog has had a known tick bite, or you live in or have traveled to an area with ticks, and they start showing any combination of these signs, even if it seems relatively mild at first, like just some lethargy and a bit less interest in food, it's worth mentioning that tick exposure history to your vet, because it can really help guide what we test for and how quickly we move on treatment. I also want to be upfront about something important. A lot of dogs who get infected with tick-borne diseases don't necessarily show symptoms right away, and in some cases might not show obvious symptoms at all for quite a while, or ever, depending on the specific disease and the individual dog's immune response. This is actually one of the reasons vets often recommend routine tick-borne disease screening as part of annual wellness testing, even in dogs who seem perfectly healthy, particularly if they live in or have any exposure to tick-prone areas, because catching an infection early, even before obvious symptoms develop, generally leads to a much better outcome than waiting until a dog becomes visibly unwell. So let's talk about diagnosis, how we actually figure out whether a dog has one of these tick-borne diseases. The most common approach starts with a simple in-clinic blood test that can screen for several of these diseases at once, including Lyme disease ehrlichiosis, anaplasmosis, and heartworm disease, all from a small blood sample, often with results available within just a few minutes right there in the clinic. This is actually the same test a lot of vets run as part of routine annual wellness visits, which is exactly why that annual screening approach is so valuable. It can pick up an infection even in a dog who isn't showing any symptoms yet. If a screening test comes back positive, or if a dog is showing symptoms that make us suspicious even with a negative initial screen, we might follow up with more specific testing to confirm exactly which disease we're dealing with, assess how significantly it might be affecting different body systems, and guide treatment decisions. This could include more detailed blood work looking at organ function, a complete blood count to check for anemia, or abnormalities in white blood cells and platelets, urine testing, particularly important for Lyme disease given the kidney concerns I mentioned earlier, and in some cases more specialized testing to identify the exact pathogen involved, or assess disease severity. It's also worth mentioning that a positive test result doesn't automatically mean a dog needs aggressive treatment in every single case. This really depends on the specific disease, whether the dog is showing clinical signs, and what additional testing reveals about their overall health status. Your vet will help interpret what a positive result actually means for your individual dog and guide the right next steps. Now let's talk about treatment, because I know this is what a lot of you are wondering about if your dog has been diagnosed with one of these conditions. For the bacterial tick-borne diseases, Lyme disease, ehrlichiosis, anaplasmosis, and Rocky Mountain spotted fever, the mainstay of treatment is typically a course of antibiotics, most commonly a medication called doxycycline, given over several weeks. Many dogs show noticeable improvement in their symptoms within just a few days of starting treatment, though the full course still needs to be completed even after your dog seems to be feeling better, to make sure the infection is properly cleared and to reduce the risk of relapse or progression to more chronic disease. For dogs who are more significantly unwell at the time of diagnosis, particularly with conditions like severe ehrlichiosis affecting the bone marrow or Lyme nephritis affecting the kidneys, treatment can become considerably more involved, potentially requiring hospitalization, supportive care like intravenous fluids, and additional medications to manage complications like anemia, bleeding disorders, or kidney dysfunction. This is really why catching these diseases early makes such a significant difference. The earlier we identify and start treating a tick-borne disease, generally the more straightforward the treatment course and the better the overall outcome. For tick paralysis, as I mentioned, the priority is finding and removing every single tick from the dog's body, which sometimes requires a thorough, careful search through their entire coat because it can genuinely just take one tick to cause the problem. Once the tick or ticks are removed, most dogs begin recovering within a relatively short period, though dogs showing more severe respiratory involvement may need hospitalization and supportive care, including oxygen support while they recover. I also want to mention that even after successful treatment, some dogs, particularly with certain tick-borne diseases like Lyme disease, might have residual antibodies detectable on blood tests for an extended period afterward, even once the infection itself has been cleared, which is something your vet will factor in if they're monitoring your dog's status over time with follow-up testing. Now, let's get into what I think is really the most important part of this whole conversation: prevention. Because honestly, with tick-borne diseases, prevention really is dramatically more effective, safer, and less costly than dealing with treatment after the fact. The absolute cornerstone of prevention is using a reliable, veterinarian-recommended tick preventative consistently all year round. I really want to emphasize that last part, all year round, because this is where I see so many owners fall into a trap. A lot of people think of tick prevention as a warm weather thing and either skip doses or stop giving preventatives altogether once the weather cools down. But as we talked about earlier, certain tick species, including the brown dog tick, can actually survive and remain active indoors, in kennels, in homes, completely independent of outdoor temperatures. And even outdoor tick species are increasingly staying active for much longer stretches of the year than they used to in many regions. So the message from the veterinary and parasitology community has really been consistent on this. Year-round prevention is now considered essential, not optional, no matter where you live or what season it is. There are quite a few different types of tick preventatives available these days, including oral chewable tablets, topical spot-on treatments applied to the skin, and tick collars, and your vet can help you figure out which option makes the most sense for your dog based on their lifestyle, any other medications they're on, and your own preferences around administration. What matters most isn't necessarily which specific product you use, but that you're using something effective consistently, without gaps in coverage, because even a missed dose or a delayed reapplication can leave a window of vulnerability. Beyond preventative medication, there are some practical everyday habits that really help reduce your dog's tick exposure and catch any ticks quickly if they do latch on. After walks, hikes, or any time your dog has been outside in grassy, wooded, or brushy areas, doing a thorough physical check of their coat and skin is a great habit to build, running your hands over their entire body, paying particular attention to areas like around the ears, between the toes and the armpits and groin area, and around the neck and collar area, since these are common spots ticks like to attach. If you do find a tick attached to your dog, removing it properly and promptly really matters, because as I mentioned earlier, disease transmission risk generally increases the longer a tick remains attached. Using a proper tick removal tool or fine-tipped tweezers, grasp the tick as close to the skin as possible and pull straight up and out with steady, even pressure, avoiding twisting or crushing the tick's body, which can potentially increase the risk of pathogen transmission or leave mouthparts embedded in the skin. After removal, clean the area with an antiseptic, and it's worth keeping an eye on your dog over the following days and weeks for any signs of illness, and letting your vet know about the tick bite, particularly if it was attached for an extended period. Keeping your yard and outdoor spaces less tick-friendly can also help reduce exposure. Things like keeping grass mowed short, clearing brush and leaf litter, and creating a barrier of wood chips or gravel between wooded areas and the parts of your yard your dog spends time in, since ticks generally prefer areas with taller grass, brush, and leaf litter rather than open, well-maintained spaces. Vaccination is also worth discussing with your vet, particularly for Lyme disease, since there is a vaccine available for dogs. Whether vaccination makes sense for your particular dog really depends on your geographic location and your dog's individual risk level. Since Lyme vaccination is generally considered a risk-based decision rather than something every single dog automatically needs. In areas with historically high Lyme prevalence, or in regions where risk is now expanding into new territory, your vet may well recommend it as an additional layer of protection alongside consistent tick preventative use, since research has shown vaccination can help reduce both the likelihood of infection and the severity of disease in dogs who do become exposed. Annual testing is another piece of this puzzle that I really want to highlight because, as we discussed, a lot of dogs with tick-borne infections don't show obvious symptoms, particularly in earlier stages. Routine annual screening, especially using those combination tests that check for several tick-borne diseases plus heartworm at once, gives us a real opportunity to catch infections early, before they've had a chance to progress to something more serious, even in dogs who seem completely healthy on the surface. I really do recommend this as a standard part of annual wellness care for basically every dog at this point, given how much the risk landscape has expanded. If you're planning to travel with your dog to a different region, or if you've recently moved somewhere new, it's worth having a conversation with your vet about the specific tick-borne disease risks in that particular area, since risk really does vary quite a bit by region, and your prevention strategy might need some adjustment based on where you and your dog will actually be spending time. I also want to touch on a topic that's become increasingly relevant, which is new and emerging tick-related threats beyond just the diseases we've traditionally focused on. There's been growing attention recently on other parasitic threats that can affect dogs, including concerns in certain regions about pests like New World screwworm, which, while not tick-borne itself, reflects the broader point that the landscape of parasite-related risks facing dogs is genuinely shifting and expanding. And staying informed and working closely with your vet about current regional risks really is valuable, rather than relying purely on what used to be considered standard advice even just a few years back. I know this has been a lot of information, so let me try to bring it all together into some practical, actionable takeaways. Tick-borne diseases are a genuinely expanding risk across the country, no longer confined to the specific regions they were traditionally associated with, and this expansion appears to be continuing, driven by a combination of environmental and ecological factors. The main diseases to be aware of include Lyme disease, ehrlichiosis, anaplasmosis, Rocky Mountain spotted fever, and tick paralysis, each with somewhat overlapping but distinct symptoms, generally including lethargy, reduced appetite, fever, and joint pain or lameness as common warning signs. Diagnosis typically starts with routine screening blood work, which can often be done right in your vet's clinic, and treatment for the bacterial diseases generally involves a course of antibiotics, with better outcomes strongly associated with earlier detection and treatment. Tick paralysis is managed primarily through prompt, thorough tick removal. And when it comes to protecting your dog, the most important things you can do are using a reliable tick preventative consistently, year-round, without gaps, doing regular physical tick checks after your dog spends time outdoors, removing any ticks you find promptly and properly, considering Lyme vaccination if it's appropriate for your dog's risk level and location, keeping your yard less hospitable to ticks, and making sure your dog gets routine annual screening for tick-borne diseases as part of their regular wellness care, even if they seem perfectly healthy. I really want to leave you with this thought: tick-borne diseases are one of those areas of pet health where a relatively small, consistent effort on your part, namely staying on top of prevention and routine screening, can make an enormous difference in protecting your dog from some genuinely serious and in some cases life-threatening illnesses. This isn't about being alarmist, it's really just about being informed and proactive, especially given how much the risk picture has shifted and expanded in recent years, compared to what a lot of us grew up thinking about ticks and tick season. If your dog spends any time outdoors at all, even just in your own backyard, or if you live in or travel to any area with grass, woods, or brush, please have a conversation with your vet about your current tick prevention plan, make sure it's appropriate for year-round use, and ask about whether annual tick-borne disease screening is part of your dog's regular wellness visits. And if your dog has had a known tick bite recently or is showing any of the symptoms we talked about today, please don't wait it out. Get them checked, because early detection really does make all the difference with these conditions. Alright guys, that wraps up today's deep dive into tick-borne diseases in dogs. This is such an important and rapidly evolving topic, and I really hope this gave you a clearer picture of both the risks and, more importantly, exactly what you can do to protect your dog. If you found this helpful, please give it a thumbs up, subscribe to the channel if you haven't already, and let me know in the comments if your dog has ever dealt with a tick-borne illness, or if there's a specific tick-borne disease you'd like me to do an even deeper dive on in a future video. As always, I read through every single comment, and your questions genuinely shape a lot of what I decide to cover next. Thanks so much for watching. Stay on top of that tick prevention, and I'll see you in the next one.